As you all know, I'm Helen Orton. I'm from the School of Health Sciences. So we're going from the three R's, from the main presentation, to what decided to call last night the four R's. I had no idea that we were having the three R's. So this is about reflecting, revising, and reimagining and renegotiating negotiated work-based learning for healthcare professionals. So I came across this slide, really, or quote from George Bernard Shaw, that I thought really summed up an awful lot of what we've had to do in the past year. And I also think it's pretty apt for negotiated work-based learning. So just to put this in context, so negotiated work-based learning is a level 7, 20 credit module, and it's an optional one. And it's part of our Masters for Advanced Health Practice in Healthcare, and also the Masters in Advanced Clinical Practitioner apprenticeship route as well. It's running it is actually run in both semesters, so it's a good optional module for lots of reasons, which I'll come on to. But the assessment is consists of three elements: a learning contract or bespoke module specification, which is worth 20% of the marks and 2,000 words, and then a critical reflection of the learning. And as you can see, that's 80% and 3,000 words. And within that, we would always be asking the students to put forward some recommendations so that we've got some idea of where they're going to take this project. And the third aspect is the portfolio of evidence, which is a pass-fail element, and that is their work, which is they gather the evidence from their clinical environment. But just a little bit more on that, the recommendations, because particularly when we're thinking about the apprenticeship program, we always need to think about what the students can, or the apprentices can be doing with regard to um, assessing their impact on their working environment as a result of their learning. So some of this might feed into a research project or a change report as well. So a lot of you will be pretty familiar around the characteristics of negotiated work-based learning, but basically it facilitates the development of bespoke roles which are necessary to address the views and plans of healthcare organisations. And this is increasingly important now, and it's congruent with Health Education England and the development of advanced practice roles. And it's really important as well for advanced clinical practitioners to meet the local health needs. So this is really achieved through the enhancement of capability and capacity and productivity, and also efficiency within a multi-professional team, and more integrated models of care as well. But it enables this education to be delivered in partnership with increased collaboration between the education providers, i.e. us, and the service provider as part of that tripartite agreement. And basically this is very, the apprenticeship model follows this idea of a tripartite agreement as well. So the nature of the negotiated work-based projects tends to be really quite varied. It depends entirely on the role of the individual student, and what we think might be suitable for them, for their organisation. It's not something that we would encourage students to come and register on unless they can see a purpose and there's a real value for what they're doing. So some of the areas of practice have been development and acquisition of advanced clinical skills, such as interventional radiology, interpretation of plain radiographs, and taking on lead roles in child and mental health services. So really taking on the roles of a medic. And then development of education and competency documents. So recently we've had competency documents around proctoscopy, can never say that word, within a sexual health service, a role of pre-assessment nurses in gastroscopy, and the use of risk assessment tools in secure units. And then there are others that will develop care pathways. So we do find that Negotiated work-based learning is a useful alternative where maybe we can't run a module because we've got insufficient numbers, or maybe it clashes with another, what they really want to do clashes with something else, and they then have to pick this other module up in a different semester. So it is actually very flexible. So the characteristics are really very consistent with their curriculum and the educational strategy at the university. So thinking about authentic and active learning, experiential, very much learner-centered, relying on a high degree of autonomy. And there's a lot of critical reflection involved as well. So thinking about the impact of COVID on negotiated work-based learning, the module started. We've had three intakes of the modules, and the modules that were particularly affected have been the January from 2020 and also January 2021. So what we've had is I've had to sort of work around apprentices having break-in learning. So this is where their organisation, their employer has said, right, we need to pull you back into clinic. We can't release you for 20% of the working week. We've obviously, and we've all heard about this lack of resumption of practitioners not going back to their normal caseload or limited access to patients. There's been a lot of redeployment of staff, and that's both students, apprentices, and clinical colleagues. And then we've had a lot of cancellation of specialised external courses, social distancing from both sides, and shielding. So we've had a lot of challenges. And I think it's really important that we actually sort of don't look upon this in a negative way, and we really try to conquer some of these challenges and really discover the opportunities in those challenges. So I'm going to just illustrate this with a few examples. I was hoping to get some students or apprentices to maybe do a bit of a mini sort of video, but their workload has prevented them from doing that. So the first thing I want to actually start to think about is some of the challenges that I had, because when we start the module, which was obviously, it was February, I was trying to organise tripartite meetings with their supervisors and mentors out in practice, and I managed to get round to do quite a lot face to face and go into the clinical environment. But then all of a sudden, it was right. You can't do this, and okay, what are we going to do? We haven't got MS Teams set up, or I was a little bit slower than some trying to get onto MS Teams. And as for Zoom, well, I hadn't got a clue. So we were then having to have some conversations on the telephone, which is never ever a great way of doing it. And the other problem that I had was also not being able to see the students and their mentors, and you can never really. It's very difficult sometimes to pick up on their sort of engagement, because what happens with some trusts is that they're not allowed to have their cameras on at all. So I felt that some of my meetings were very much delivered through a black hole, and I found that really quite challenging. But looking back on this, my own personal reflection is, would I go back to face, or would I actually stay with MS Teams or Zoom? And I would actually stay with online and Teams. And the reason being is that it takes, if I've got 20 students on the module, or 25, I've got to get to see 25 different students out on different sites across Lancashire, Cheshire, Merseyside, a lot of time. So I might get 2 or 3 done as a maximum per day, whereas when I manage to do it sort of online rather, I can see them in much shorter period of time. Well, it's still an hour with them, but I don't have to worry about that travelling. And obviously it's cheaper for the university, and it saves on sort of polluting the environment as well. So there are some benefits. I mean, the only downside is that sometimes it can be a bit difficult to really get a feel for what goes on in that clinical environment. But I do tend to sort of ask a lot of questions. I push for that information, and if I'm a bit confused, I go away and read a bit and just familiarize myself as well. So some of the other challenges are the break in learning. So a significant number of apprentices were affected by this forced break in learning by their NHS trusts. And some of the apprentices managed to return within, I've put 4 weeks, I meant 4 months, 1 year, or even 18 months. So some haven't even come back. So that is actually really difficult, because for some, it means that the challenges and opportunities that came to them as a result of COVID have meant that they've got new roles and new jobs and promotions. And some of them have had to accelerate their negotiated work-based project without any academic supervision. So we've then had to go back and sort of see where we can work with it to sort of take it up onto that next level so that it fits into the model that's required. So that can be challenging. We've had apprentices who have not been. We've got one, for example, who failed their portfolio of evidence, and they've now been completely moved from one hospital to another, but still within the same trust. So we're having to be very creative in trying to think how they can actually demonstrate their own learning as a consequence to this move. So it's almost rather retrospective, but that's the way the cookies crumbled. We had one particular student, and this has happened to others, but a student who is not an apprentice and not on the apprenticeship program, but they are a specialist nurse organ donation, a SNOD as we call them. And their role is to facilitate the option and process of organ donation to NHS patients. And what they were wanting to do was really understand and maximize their knowledge, and so they could utilize it in clinical practice. The technique of cardiac echocardiography, cardiography, honestly, sorry. and it requires that interpreter to really understand a lot of anatomy and physiology. But their original idea was that they would go off and do this work-based learning, but it was very dependent on their completion of this externally run course. And this course kept being cancelled, and quite understandably so. So we got to the stage with this student where we thought, come on, we've got to do something. And they got one sort of version of a bespoke module specification done. So I just said, right, we need to start almost put this to one side and almost start from scratch. And what we actually did was proved to be far more beneficial, because what we realized, or what the learner realized, was actually they didn't really know very much anatomy and physiology. And the more I sort of talked to them about this course, and the more I sort of said, have you looked at this article, and have you looked at this, and they thought, oh heck, I don't actually really know some of the basics I need. So we revised this so that they were then able to apply in-depth knowledge of anatomy and physiology, to the cardiac system, and relate that to the interpretation of ultrasound images. They were then able to identify common pathological changes in thoracic ECGs and their relevance to heart transplantation. And also, it made them take a far more critical approach. They did some critical appraisals of literature. So they were very, very much better prepared to take on board this external course. Now, I think the course is probably going to happen in September, but it's well known, and this student and several other nursing students wouldn't mind me saying that their knowledge of anatomy and physiology is really poor. A lot of their work tends to be task orientated. So when you then start to say, well, why is that happening? Give me the reasons of why, what factors might influence them, and they've got to start doing a critical reflection and critical appraisal, they really struggle. So in fact, COVID did this student a really big favour. Some of the other issues were around cessation of normal services and social distancing, and this was affected by the first wave of the pandemic. And the aim of this negotiated work-based learning project was for this learning disability trainee advanced clinical practitioner to design a program of learning and then implement a good thinking skills group. And this was going to meet weekly face to face for up to 18 months. So the idea of this group is really to improve outcomes for men who have got a diagnosis of a learning disability, who also have challenging behaviours and fluctuating mental health and risks that are associated with forensic sort of type of behaviours. So, um, it, they are incredibly sensitive to bad news, and I remember speaking to quite a few from Merseycare, who said they were absolutely astounded by the reaction of that they to Caroline Flack's death. And I only bring this up. I don't watch Love Island, by the way, and you can take this out of the presentation when you edit it. But they would get really quite upset, and their behaviors and everything change. So they are very uh, they're very sensitive to changes around them and environmental changes. So we then had to also think about how we were going to, how this individual student was going to carry on with this. And although they were obviously very keen to do this on a face-to-face basis, they had to then start to look at ways in which they could implement this program of learning for these uh, patients with learning disabilities on an online environment, which obviously, you can imagine that there would be serious technological challenges, which they did actually manage to overcome. So it was a bit of a short-term fix. In the second wave, we had issues that affected us around shielding and reduced patient contact. And this is very much where we've got a very clinically focused negotiated work-based learning. So the student had to curtail her clinical practice because she had to shield from the start of her third trimester of pregnancy. So she wasn't able to meet all her learning outcomes. So we managed to set up an additional tripartite meeting to address how this could be managed. And it's a um, really reassuring way in which the medic involved sort of just embraced this along with the apprentice about the fact that in this instance, the learner is going to utilize their keeping in touch days to gain more clinical experience. So when they come back after mat leave, they're going to be much sort of more prepared. And the mentor is going to continue to supervise them on the same sort of level that they were before they went off when they return to work. And we will then review the achievement of their learning outcomes, and the student will remain in contact with me as the module leader. So just thinking about addressing the challenges within the academic assignment as well, and the learning contract and critical reflection, negotiating with me as the module leader and also the mentor out in practice was key. I have to say that the mentor sometimes got a bit lost, but we still did manage to maintain that tripartite meeting or arrangement. And again, the mentors found they found that challenging again because they were being redeployed. So generally speaking, what we found was that the learning contracts didn't have to change that much, apart from where we had a completely different direction. Within the critical reflections, we really wanted the learners to be very honest about both the challenges associated with the module and the proposed solutions. And I think that was the thing, that we were never going to be completely. We weren't going to not be able to complete these modules. We just thought, right, we've just got to have a good old rethink. What can we do given the circumstances? And that's exactly what we did. And we implemented post-module sort of action plans. It did mean that they could then complete the module, and that they were actually, I mean, with COVID and everything, we all know that there were so many revisions and submission dates, and we had breaks in learning, we had resits because learners weren't able to submit anything. So at the end of the day, I would say that we've managed to respond to the COVID challenges. At the time, you just think, oh my goodness, what can we do here? But it does rely on me being very creative in some ways. And sometimes the students, learners might just think, not sure what I'm going to be able to do, whether I can do this. And we say, no, we've got to do this. We've got to remain positive. So that was my experience of revising, reflecting, reimagining, and renegotiating work-based learning. Thank you.